Prop 23, and we have Sonia
Pettick.
Thank you.
Thank you, Professor Nalder. Yes, I'm Sonia Pettick, and I'll be discussing Proposition 23, which concerns dialysis clinics. And by way of a very brief background, California currently has about 600 licensed dialysis clinics in the state, each of which is overseen by a medical director who must be a board-certified physician and whose responsibilities typically take about a quarter of a full-time position. Together, these roughly 600 clinics see approximately 80,000 patients per month. Dialysis, people who have kidney failure either require dialysis or a kidney transplant. So what happens is a patient's own doctor will refer them to a dialysis clinic for treatment. And the patient will receive dialysis treatments about 3 times a week, and each treatment lasts about 4 hours. Because of this robust treatment schedule, many of the clinics are often open 6 days a week and are often open beyond a typical 8-hour business day. The way that dialysis is paid for is through a patient's private health insurance, or if they receive public health insurance, which is Medi-Cal in California, the state's Medicaid program, or they receive federal Medicare. Now, having kidney failure is a condition that qualifies most patients for Medicare in the long run. Before Medicare payments kick in, either Medi-Cal or the patient's private insurance would serve as the primary payer. Dialysis clinics are also currently required to report infection-related data to the federal government. So Proposition 23 would make a few changes. One is that it would require a licensed doctor to be on site at the clinic during all treatment hours. If the clinic's in an area with a doctor shortage, they could apply for an exception to have either a nurse practitioner or physician assistant fulfill that role. Proposition 23 also requires that clinics report infection data not only to the federal government, but also to the state. And it requires clinics to obtain the consent of the California Department of Public Health prior to closing or substantially reducing services. Now, because this measure would require clinics to have a doctor on site during all treatment hours, we estimate that this would increase costs for a clinic by several $100,000 annually. In response to these higher costs, we expect that clinics would try to negotiate there would be one of several responses. They would either try to negotiate higher rates with health insurance plans, including Medi-Cal or Medicare, as well as private plans. They may continue current operations, but at receiving lower profits, or they may decide to close some clinics. We estimate that because of clinics potentially negotiating higher payment rates from Medi-Cal and from the health insurance plans that cover state and local public employees, that the cost to state and local governments could be in the low tens of millions of dollars annually. Thank you.
Thank you. All right, so this was put on essentially by union members that would want to, their unions would want to unionize the clinics. So the Democratic Party, the Green Party, and Peace and Freedom Party are all in support, and the Republican and Libertarian parties are in opposition. We have only opposition from newspapers, and most newspapers across the state do oppose it. In support, we have Courage California, the Labor Federation, firefighters, a couple of unions there. In opposition, we have the Chamber of Commerce, the California Medical Association, the NAACP State Conference, and the Friends Committee on Legislation. And then the money here is really intense as well. So essentially we have the dialysis companies pouring $60 million for DaVita and the other one, $26 million. So it's all dialysis related companies. And so it's those dialysis companies are totaling over $100 million against it. So clearly they think it would impact their bottom line having to have a doctor on staff all the time. All right, questions on this one. I had a question. We did some ad watches with KCRA earlier on this, and some of the ads depict dirty conditions at the dialysis clinics. Is there any evidence of that?
That's a good question. The clinics do need to report infection-related information to the federal government already. So while I can't comment on the current conditions at the clinics, there is sort of that federal oversight currently built in. And this measure, as you know, would require that data to also be reported to the California Department of Public Health.
So currently it's already reported to the feds, so that the reporting requirements are not, brand new. It's different they're reporting to the state as well. Is that
yes,
right?
It's conceivable that the Department of Public Health could have slightly different reporting requirements or request additional information from the clinics, or it could just ask the clinics to share what they report to the federal government, to the state Department of Public Health. The measure stipulates that the department would be in charge of deciding what should be reported and in what form. It does also require the department to post that information publicly on their website.
Great. Is there any data available summarizing the negative impact on the status quo of not having doctors available?
That's a question that's really outside the scope of our current, analysis on this particular initiative.
Okay. Do we know the position of the California Department of Public Health?
I am not aware of them taking a position. I can't say for sure one way or the other. I do know that the department would have increased administrative costs just in terms of writing the regulations and making sure clinics report the infection information, assessing penalties if they don't report the information. However, a lot of those additional costs all of those additional costs to the department would be covered by license fees assessed on the clinics.
Okay. And I guess this is sort of an ask, but is there a rationale for why we need a doctor at every clinic as opposed to just the medical director who would have been overseeing it, in a general way?
Again, that's a question that's really sort of outside the scope of our analysis.
Gotcha. All right. Thank you so much.
Thank you.